Hi, I'm Dr. Linda Mintle. Hey, thanks for listening to the Dr. Linda Mintle Show. Faith radio podcasts are only possible because of your support. Thanks for giving and for sharing with a friend.
Doing life together, reaching out with hope, encouraging one another, each step along the road. You and I can make everything a little better, doing life together.
Well, hi, everyone, and welcome to the Dr. Linda Mintle Show. I'm your host, Dr. Linda Mintle, the relationship doctor, and I'm here along with my co-host, the other Dr. Mintle, my husband, Norm. And every weekend we are here, we are doing life together, and as always, we're so glad you joined us.
Yes, we are. It's you just have to imagine how many people are with us who have joined us. I think of people in spaces and across the whole part
Where
of the
they
United
are,
States.
what they're doing.
Yeah.
And fortunately, we're on radio today because you just had a wonderful procedure done on your head, which we're going to just tell everybody, get your skin cancer checks because it's so
That's
important. And Norm did a chemo cap, so he's looking a lot red and scaly right now, but it's a preventative procedure that really helps you with your skin.
I look like the Walking
Yeah,
Dead.
it does look a little bit screaming at this point,
Yes,
but
yes.
it's going to get better, and that's the good thing. And this is just part of us being very preventative with our skin.
With our healthcare. Yes,
That's right.
it is.
So speaking of healthcare,
Speaking of healthcare, we're going to talk about a topic today that I don't understand. And I don't think most of us do, but we use the word all the time, and I'm going to guess we use it wrong, bipolar. We always say, well, that person's so bipolar. What does that mean?
yeah, it is a wrong use of the term because most of the time what people are describing, Norm, is someone who just changes their mind quickly or is moody, like going from happy to sad, or someone who's just acting very unpredictable. But that's a stereotype, and it's not a good description of what we're calling bipolar depression.
Okay. Do you think the media contribute to this? Because whenever we see a celebrity acting erratically, then somebody slaps that label on them. Well, they must be bipolar.
Yeah, I do think that's a problem. I mean, erratic behavior can be due to a whole lot of things,
Right.
right? There could
Of
be all
course.
kinds of reasons that might be happening, maybe unrelated to anything related to bipolar depression.
Okay, so you've added the word depression. Let's get back to that. Bipolar depression. Most people know about depression, but they may not understand the difference between two different types.
That's right. So that's one of the reasons why we're doing this show, because what we think about when we think about depression is what we call in the clinical world unipolar depression,
Uni meaning one.
meaning one type.
Okay.
But it has a very specific meaning. It's depression that has certain signs and symptoms, but it is different from bipolar depression. We call that unipolar depression. That's what people use the label and they say, oh, that person's majorly depressed or depressed.
Okay, so let's talk about major depression, the unipolar type. Did I get that right?
did.
Major and unipolar are the same.
Yeah,
Okay.
same thing.
Okay, so what are the signs we look for of major non-bipolar depression? That's difficult for me to get it all
Major
out. Yeah, right.
major non-bipolar depression.
In other words, the first kind.
The first kind, right. So to be clinically diagnosed, it's just, most people just go by, it's called a major depression.
Okay.
Okay. You have to have 5 signs out of 9 symptoms.
Oh,
and
okay.
those have to be occurring for at least 2 weeks in a row. And here's the important part. So this is what distinguishes it from bipolar. You cannot have any prior history ever in your life of what is a manic or a hypomanic episode. So we're going to talk about what mania is
Yep,
and
okay.
hypomania is in a moment. But just think about that. This is just 5 of 9 symptoms with no history of this thing we haven't defined yet.
Got it.
Okay?
Okay, so before we define what manic or hypomanic episodes are, what are the 9 symptoms you mentioned that are used to diagnose major depression?
Okay, so when we're talking about major depression, they include depressed mood, something called anhedonia, which is really just losing interest in stuff. You just feel like you don't have
Kinda zone
pleasure.
out.
You don't have pleasure.
Yeah.
You're losing interest. Appetite changes, energy changes, suicidal thoughts, sleep changes, feelings of worthlessness, concentration problems, and psychomotor changes, which really is just about slowing down or getting more agitated or restless. So if you have any of those symptoms, you have to have 5 of those to be diagnosed with major depressive disorder. Now, those symptoms also appear in bipolar depression, but there's a unique difference, and that's where we're getting to.
Okay, so let me see if I have this. If you are depressed and have any history at all of mania or hypomania, you are no longer in the major depression or unidepression or unipolar depression. I'll get it right, I promise. This is tricky for me. But the diagnosis then becomes bipolar depression. That's correct?
Yes.
Okay.
So major depression is defined by the symptoms we just mentioned,
Yes.
right? But when you look at your history, and there has never been a manic or hypomanic, it just stays major depression. But even if you have all those symptoms, but you've had a manic or hypomanic episode, you are no longer in the unipolar category. You are now in bipolar depression.
Okay,
Does
so
that
now-
make sense?
Yeah, I'm getting there. It does. So now explain to me what mania and hypomania are,
Okay.
since they're associated with the bipolar depression only.
Right, right. So mania is a distinct period of abnormally elevated, expansive, or irritable mood. So when you see people in this manic state, they're just really happy and excited. Problem is sometimes then it drops to a very strong depression.
But that means
later.
that's not normally how they are. This is
Right.
it's hyped
It's
up.
a mania
Yeah,
state,
okay.
yeah. And it also includes increased energy levels, so they feel like they can tackle everything, decreased need for sleep. So a lot of times they don't sleep for, maybe days on end or just a couple hours during that time. They have racing thoughts, so they're talking a lot. They have poor judgment and a lot of risk-taking behaviors because they feel on top of the world.
Like they can do everything.
Yes.
I got
And
it.
so those types of symptoms, or mood as we're calling it, must be present for at least a week and occur most of the day if we're going to diagnose bipolar 1. Okay. Now there's another type of bipolar disorder, which is called bipolar 2, and there's even one called cyclothymic. But there's the hypomania is characteristic of that type, and that doesn't last for as long. So a little bit more like 4 days rather than a week. It's not as intense. Usually all those things I described in mania, those don't happen at such a high rate that people end up in the hospital.
Okay.
Because, Norm, a lot of times when people are in a state of mania and they're not being treated, they do things that get them in trouble
Like
and end
what?
up in a hospital.
Yeah, like what? So what is happening in a
I
manic
mean, they
episode?
could be doing all kinds of stuff. They could be shoplifting, they could be overspending, they could be using substance abuse, engaging in risky behaviors, reckless driving, sexual acting out. It's basically like a surge of energy or euphoria, and your impulsivity gets really high, which causes you then to have a lot of these grandiose thoughts and racing thoughts, and a person seems kind of jumpy, talks a mile a minute, which can then lead to a lot of poor acting out and behavior and impulsive behavior.
Okay. I'm getting this. So during mania, someone may actually like the way they feel, since it can make them feel extremely happy and powerful and invincible and energetic with lots of ideas, but are hard to control.
Yeah, that's the so-called positive side, right? But the poor judgment that comes with mania, in which the person then makes rash and harmful or inappropriate decisions, hurts the person and it hurts relationships. In severe untreated cases, a person can even get so into that manic state that they become delusional or even hallucinate.
Oh, wow.
So that's in the real severe episodes. But after an episode, the person just feels exhausted, sometimes ashamed because of things that they've been doing. And they sometimes even have few memories of the event. So depending on how racing their mind is and their thoughts are, they may have made some significant and unmanageable commitments during that manic phase, which means it needs to be treated.
So give me an example. What would that look like?
Okay, so you could be extremely excited about an idea for a new healthy snack bar, let's just say, okay? You believe the snack could make you an instant millionaire because you've never even cooked a single meal in your whole life. You don't know anything about developing a business plan, and you have no money to start a business. So in this manic state, you might even spend your life savings to make this happen. So you just get out of control and out of touch with reality. And a lot of times people end up in the hospital because of that. Sometimes they're doing things that could be harmful to themselves or others, and that's another reason. They just spiral into this really negative state.
But you talked about something called hypomania, which you said just lasts a shorter time period. But what else?
It's not as severe. It doesn't usually cause problems that land the person in the hospital, like I said. The symptoms we mentioned are there, but they're not as intense. They're not causing as significant problems, and they don't cause a person to lose touch with reality.
Okay. So how would I know the difference if I were experiencing just feeling really great today or hypomania?
Yeah, it may take some time to recognize that. When your mood gets really elevated and is different, people around you usually notice the change. So that's one of the problems, Norm, is that sometimes we don't notice it right away because it isn't creating a huge impairment in a person's life, but it is definitely distinct. And when you start asking patients questions about, did you ever have a period of about 3 or 4 days where you weren't sleeping much and you felt really elevated and you felt like really singly goal-directed and stuff, they'll start to think about it. And that is hypomania. So here's another way to think about it. It can look like an intense cleaning frenzy, maybe staying up to 3 in the morning or not going to bed and not feeling tired the next morning, or maybe working on a project 20 hours straight. Sometimes it shows up like you can't fail anything you want to do, even if you don't have the training. Maybe you call or text your friend all day or all night, post on social media, or you're jumping from subject to subject in conversations and your speech is just extra fast. You can get hyper-focused on something or do things impulsively that you would never do when you're not hypomanic or manic.
Okay, so now I'll go back to the very beginning of my thinking. Why? What causes this?
Well, it's a brain disorder with many factors. And if you have another family member with bipolar depression, you have an increased risk of developing mania.
Okay.
We also see that this is related, to chemical imbalance in the brain, which is why in this case, when you're dealing with bipolar depression, you probably need medication to control that mania and that hypermania. In some cases, mania can be a side effect of a medication and not a bipolar disorder.
So
and the reason,
some other medication interacts
yeah,
with...
and I'll bring this up because I can think of a case where somebody could be on heavy doses of steroids for maybe some kind of kidney problem or some kind of treatment that they're doing medically. And this happens to people. They get into this manic state based on what those medications are doing to them. And it turns out that it's really related to the medication. And once you take them off the medication, then that goes away. And that's related to the medication. It's caused specifically by that. It's not bipolar when that happens.
So can severe stress, maybe, or a significant change in your life, like a divorce or death of a loved one, bring this on?
Well, any unusually high stress and the inability to manage it over time can really activate bipolar depression. And that's sometimes when we see it starting to happen. Even a lack of sleep or change in your sleep habits can bring it on. However, we don't typically notice this disorder until like late teens and early adulthood. Also, a lot of other mental health conditions can have some of these symptoms that we've been discussing. So it's really important to make sure you get the right diagnosis. I can't overstress that this diagnosis is often misdiagnosed.
And what does that entail?
Well, you'll be asked by your medical or psychotherapist, you'll be asked your family history. You'll be asked about any current prescriptions or non-prescriptions, even herbal medications, products, supplements. You might be asked to do blood work and or a body scan to rule out any other medical conditions that can present like mania. So, for example, hyperthyroidism can have some similar looks to it. But it's diagnosed mainly by the presence of those manic or hypomanic episodes, and often followed by a crash or a depression. That's where that bipolar part comes in. You're at an extreme high and then you crash into a low. And this is a legitimate medical illness. It's not a spiritual failure.
Well, that's a good point. Okay. Well, it certainly sounds like it has to be treated. So after this break, we're going to talk about what to do, and spiritual implications. Right after this on the Dr. Linda Mintle Show.
Hi, I'm Dr. Linda Mintle of the Dr. Linda Mintle Show.
And I'm Dr. James Cribbs, and we co-authored a book, Living Beyond Pain.
If you're one of the 100 million people suffering from chronic pain, this is a book for you, Living Beyond Pain, in stores now.
You're listening to the Dr. Linda Mintle Show, and I'd love to remind you to please check out Dr. Linda's books and her blogs. They're at her website, drlindamintle.com. That's where you can connect with her as well on social media. You can follow her on X and Instagram at the little @ Dr. Linda Mintle, or on Facebook at Dr. Linda Mintle, author and speaker. And don't forget, Dr. Linda's latest book is a workbook on anxiety that anyone can use to better understand any kind of anxiety they may be experiencing and how to eliminate it. It's called Hope and Healing for Anxiety, and it's linked on her website, drlindamintle.com. Or you can find it online anywhere you buy your books. Okay, Linda, before the break, we talked about how to recognize bipolar depression. How is it treated?
Yeah, I want to get into that, but I want to make sure, again, I'm going to repeat this because it's so important, because I can't tell you, Norm, in clinical practice, how many times I would work with a client and they would have the wrong diagnosis. You have to get this properly diagnosed, and you make sure when you are talking about any kind of depressive symptoms that the person asks you about the mania and the hypomania in your history, because if they don't ask, the treatment is very different depending on the type of depression that gets diagnosed. Bipolar depression often gets misdiagnosed as ADHD, so attention deficit disorder in some people, or a unipolar depression because the person doesn't ask about the history of mania and hypomania. And like I said, the wrong medication can actually worsen bipolar depression. So there are medications that are used for that major depression, unipolar, that we started with, but they're not the same medications that treat bipolar. And that's not true of all psychiatric disorders, but if this is it, you really do need the medication. I mean, sometimes you can work on a psychiatric diagnosis without medication. I would say this one, no. I've not seen that be true because of the way the brain is functioning and what is happening in the brain. And one of the reasons that you want to treat this early is because if you don't, these manic episodes can become more frequent and they happen more often. So a lot of times people will think, well, I'll just wait it out or I'll just deal with it. Nothing terrible happened this time. But it really actually over time, the data shows that things get worse. So you really have to treat it.
Mm-hmm. We watched a television show some time ago in which the main character probably had bipolar.
Right,
and when on her medication, she was a brilliant, wonderful CIA analyst. But when she went off, everything you've described made me think of her. She was talking fast and she had all these grandiose ideas and she worked all night, really
acted out,
did crazy things, right?
Yeah. So the difference is, and this is why, again, remember when you said people like the positive feeling of all that energy and that elated state? That's the biggest sort of barrier to people staying on the meds, because they like the way they feel when they're on them, and when they just get into sort of a stable mood, it feels boring to some people. They don't feel as creative. They don't feel as like they're accomplishing, but the instability is really a problem, and so many things happen, especially with straining relationships, because you have these mood swings, poor communication, you break trust often, there's a lot of emotional instability, and all those things can happen that we talked about, where you're spending, maybe infidelity, all this grandiosity, and then the severe depression that comes with it on the other side. All of that really impacts your relationships if you don't treat it.
Does the person who's experiencing this realize what's going on?
Sometimes yes, sometimes no. Again, remember, I mentioned that sometimes in a severe mania, you may not remember much about that time. But a lot of times, it just depends on the type of manic episode that you have.
Well, it certainly seems to me, keeping with the major theme of our program, relationships, this has got to be incredibly difficult on friendships and family relationships and spousal relationships.
If it's not treated and managed. So I want to make that point because, like you said, people can live very stable lives, very consistent with their lives, and have no issues if they continue on those medications. So I think that's the point, is that you have to get it treated. Just like you would treat diabetes
Sure.
or heart disease. You wouldn't just say, well, I'm just going to wait that out. You'd want to go get the treatment. So living with this unmanaged is really like an emotional roller coaster. And it can wear down your partner, your family, and your friends and put you in danger. And, it's like what we talked about when we were watching that show. All the sort of carnage that the lead character would produce based on being off her meds.
Right. There was utter destruction everywhere she went.
But she was very goal focused on getting something done, and she did. But it was at such a cost to everybody around her.
Right. Well, it seems like the writers and producers of that program had really done their homework.
They did. I think so,
on
too.
This. So is what we saw in her is she didn't want to take her meds because it felt so good. Is that how and why people resist getting the help they need?
Yeah, and the energy that she had. You have energy to really focus and accomplish something. You don't have to sleep. You can just keep working on it. And some people feel like they're very creative when they're in that state. And sometimes, they just stop their meds to get that feeling back and to feel like they can be more productive, but then they're going to trigger one of these manic episodes, which, again, we just talked about the price that comes with this. And others just think they can manage without the medications, which I've rarely seen that work. So this is a conversation that I have with patients, right? It's very unlikely that you're going to be stable without taking that medication. And it's going to have a huge influence. And I can't tell you the number of people who have gotten divorced because they did not take the medications, would not work with their partner, and the fluctuating mood and, the spending and the infidelity and all the things, the grandiosity was just a lot for people to take.
Well, eventually the partner has to say, I've tried, and this is
You need to do
working.
your part and
Yeah,
take the meds. Right.
So they have to be, the person has to be committed to treatment or else.
Yeah, and for a lifetime, because it doesn't go away. And it often gets triggered with stress and a lack of sleep. So this is definitely one that needs to be treated with medication, in my opinion.
So I want to get to the spiritual aspects. How do we think about bipolar depression from a spiritual perspective?
It's a medical illness. So people with this disorder have the same spiritual needs as anyone else, right? Research indicates that a strong spiritual life is associated with an improved mood and quality of life. We've talked about that on every mental health issue we've talked about. And since severe and chronic stress are often a trigger, we need what King Solomon called in Proverbs 14 a tranquil heart.
That verse says, a tranquil heart is life to the body. It's talking about peace, right?
Yeah, so we use all the tools the Bible gives us to trust in God, despite the suffering we sometimes face. However, as we've discussed in a lot of shows, suffering has meaning in the Christian faith and often draws us closer to God if we choose to let it.
Right. Which often goes back to accepting that there is, sadly, suffering in this world. But we also have to have, and we do have, a hope for eternity that the suffering will end.
So in the meantime, we daily renew our mind with the mind of Christ. That is why therapies like cognitive behavioral therapy help when done from a Christian perspective. They work on your thoughts, your emotions, your perceptions, and they help align all of that with the Bible. Your thoughts significantly impact your emotions and emotional stability. And take the medication called mood stabilizers to keep you from spinning out. We have treatment for all of this.
That's really good news. And I think if we look at it as any other illness, as you mentioned, like some of the others, we all get sick, we all go to the doctor, we don't stay away, but we also use spiritual wisdom to live better, healthier, more productive, tranquil, to use Solomon's word, lives.
And I just want to say, if you commit any sinful acts in the middle of a manic episode, you do what any believer would do: repent, seek forgiveness. Can't blame your illness on your actions, but you can treat your illness to prevent those actions from occurring. So treatment is key for bipolar depression. It doesn't get better on its own, but with God's help, it can be managed and you can live and abundant life. Well, that's all the time we have today. Many thanks to my co-host Norm Mintel, who makes the show a conversation, and to our technical producer Wan Jing Pu, and our editor Katie Sims Wilson. Hey, from all of us here at Faith Radio, we'll talk to you again next weekend. In the meantime, remember, we're doing life together, and it's better when you don't have to do it alone.
Doing life together.
Hey, thanks for listening to this conversation from the Dr. Linda Mintel Show. These conversations are available because of your support. Become a supporter now at myfaithradio.com. Please subscribe to the podcast so you don't miss any episodes, and share it with friends so we can live life to the fullest, walk confidently, and find healing and hope.